Hello friends, welcome to my channel. In today's video, we will go through qualifying circumstances and anesthesia modifier list from the anesthesia chapter. In the previous video, I discussed about all these. Anesthesia, services included and services not included in the anesthesia reporting time, anesthesia for multiple procedures and also physical status modifiers. So please go through the video and let's start today's video. Today's video is about qualifying circumstances. This section provides a list of qualifying circumstances that significantly affect the character of anesthesia care provided. So all these four are qualifying circumstances add-on codes. So these codes are added to the main anesthesia code. First, 99100 anesthesia for patient of extreme age younger than 1 year and older than 70. So whenever the patient is younger than 1 year, then we have to give this qualifying circumstances. There are exceptions for this qualifying circumstances. So the codes 00326, 00561, 00834, 00836, all these four codes, the qualifying circumstances, this add-on code 99100 should not be reported additionally because all these codes include the patient's age in the main code itself. So there is no requirement of additional code. For example, 00326 anesthesia for all procedures on the larynx and trachea in children younger than 1 year of age. So as the code itself includes younger than 1 year, then we should not report the this add-on code additionally. Next, 99166 anesthesia complicated by utilization of total body hypothermia. So whenever the physician tells about using total body hypothermia in the question during the anesthesia care for some surgeries, then we have to add this qualifying circumstances add-on code 99116. Next, 99135 anesthesia complicated by utilization of controlled hypotension. 99140 anesthesia complicated by emergency condition. Emergency condition means it should be a existing and current condition. Means when delay in treatment of the patient would lead to a significant increase in the threat to life or body part. So for example, when the patient comes with cardiac arrest, we should not delay the treatment. It is an emergency condition. For that emergency conditions, we need to add this 99140. Anesthesia complicated by emergency condition. Anesthesia modifiers list. These modifiers are specific for the anesthesia and these are very important from the examination point of view. So we need to focus more on this topic. First, AA, anesthesia given by the anesthesiologist. Whenever the anesthesia is given by anesthesiologist, we need to add the modifier AA. AD, medical supervision by a physician more than 4 anesthesia concurrent procedures. So whenever the physician is looking after the anesthesia care of more than 4 procedures at a time, then we have to give the AD code to the anesthesia procedure. In CPC exam, if we get the question like how would you report the anesthesia care given by the anesthesiologist for a patient undergoing direct coronary artery bypass grafting without pump oxygenator, the anesthesiologist is monitoring 5 other procedures at the same time. Then we have to give the code 00566 and the modifier AD. Next, QK, medical direction of 2, 3 or 4 concurrent anesthesia procedure. So whenever the anesthesiologist is monitoring 2, 3 or 4 concurrent anesthesia procedures, then we have to give QK. So these 3 are for the anesthesiologist. First one is only one procedure. Second, QK means 2, 3 or 4. AD means more than 4 anesthesia concurrent procedures. So these 3 are similar. QX, CRNA service with medical direction by the physician. So here the physician is directing the CRNA who is giving anesthesia service to the patient. QY, medical direction of one CRNA by anesthesiologist. Here the modifier is for the CRNA. Here the modifier code is for the anesthesiologist. In the CPC exam, if the question is like this, the patient is given anesthesia by the CRNA who is directed by the physician. Now give the CPT code for the physician. So here the code we have to give is for the physician, not the CRNA. So here we have to give the QY modifier, medical direction of 1 CRNA by the anesthesiologist. This is for the physician, anesthesiologist, and this is for the CRNA. If the question is like this, give the CPT procedure code for the CRNA, then we have to give QX, QZ. CRNA services without medical direction by the physician, CRNA working independently. So here no physician is directing the CRNA alone is doing the anesthesia service. Then we have to give modifier QZ. QS, monitored anesthesia care. It is the MAC procedure. G8, MAC for deep, complex, complicated or markedly invasive surgical procedure. It is the anesthesia for the complicated procedure. Q9, MAC for patient who has a history of severe cardiopulmonary condition. This means the MAC, the anesthesia care is complicated by the severe cardiopulmonary condition. For that we have to give additional modifier G9. So mastering these guidelines and details will not only strengthen your coding skills but also increase your chances of success in your CPC exam. So in the next video we will go through some CPT practice questions. If you find this video useful and helpful for your CPC exam, kindly like the video and subscribe to my channel. I will be posting videos related to CPC exam. Thank you.